Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, public health experts raising the alarm over the easing of physical distancing in public transport. Will government stand by its decision on reducing physical distance? Also, Malacanang gives a high rating to the government's COVID-19 response, with its testing capacity at par with Asia's best. And some senators question the non-inclusion of Health Secretary Francisco Duque on the task force PhilHealth findings over alleged corruption in the agency. Presidential spokesperson Harry Roque joins us live. Authorities enforce a new rule reducing the space between commuters in public vehicles, but experts, lawmakers, and the public have raised concern over this decision. The interagency task force had to meet Tuesday night to discuss this directive and come up with a resolution. Meantime, Malacanang claims the Philippines has the best COVID-19 testing policy in Asia. It also gave the government's COVID-19 response a very good grade of 85%. Let's go straight to the source of the story. We have presidential spokesperson Harry Roque. Secretary Roque, welcome to the source, and maraming salamat po sa inyong oras.
Thank you very much. It's always a pleasure, Pinky, and glad to be back.
Secretary, we missed you last week. So, any update on the policy on the reduced physical distancing?
Well, we had a 6-hour meeting yesterday, to reassess the policy which was previously approved by the IATF, and the body came up with a recommendation to be submitted to the president, and it will be the president who will ultimately decide. In fact, in the last address to the nation of the president, that's exactly what I said. Because of serious differences between two departments of government, ultimately it will have to be the president to decide. But I'd like to underscore that the decision and the recommendation of the IATF is based on science. We heard Dr. Dance, as well as former Health Secretary Manolet Dairit, and they have
Manuel
opposed. Dr. Dance was speaking on behalf of the Philippine College of Physicians, and they were the ones saying that we should not reduce the 1 meter social distancing. Dr. Manolet Dairit, on the other hand, said that studies have shown that it is the wearing of mask and sanitation, as well as prohibiting talking and the use of cell phones, that will be determinative whether or not people can be infected in public transportation and not social distancing. So I'd like to underscore that the recommendation was arrived at after 6 hours of long discussions. And take note that it was not as if it was the first time that the IATF considered the matter. It was previously approved in a meeting last Thursday. But despite that, it took us another 6 hours to discuss, and with the assistance of resource persons, all of whom are respected doctors. I'd like to underscore that Dr. Manolet Dairit was not alone in arguing that it is the wearing of masks and other, what he referred to as the 7 commandments, that will determine the spread of coronavirus in public transportation and not social distancing. Was joined in his opinion also by former Secretary Cabral, as well as other medical luminaries, including Dr. Nikita Padilla.
I see. So, Secretary Roque, when will this be presented to the president, and when can we expect a decision from the president?
I think the president will decide no later than tomorrow.
So, while the president is still going to decide on this, does the reduced physical distancing, is it pushing through? Or is it suspended?
So, because it was previously approved in the last IATF meeting last Thursday. So until the president revokes it, I think it will be implemented.
I know that you have said that during the president's address the other night. Sabi mo nga, I heard you chime in, Secretary Roque, dahil nga napag-usapan ito, because even during that address, Secretary Galvez spoke, Secretary Duque spoke, and then even Secretary Año as well, and you also, sabi mo nga, the Malacanang press corps was asking you about this. But why would there be such a recommendation and approved by the IATF when there were apprehensions to begin with? Why not was it just put on hold before you actually implement such a move or policy?
Well, that's one thing I'd like to clarify. When the IATF approved it, there was no objection. There was no controversy. The controversy came out again when medical groups, after the decision was made an issue out of it. No, but just for the information of people, no, the president brought it up because of the letter of the Philippine College of Physicians. So I asked former Secretary Manolet Dairit, what is the procedure, no, in medical organizations? Is a letter signed by the president effectively a decision of all its members? And former Health Secretary Dairit said no, there has to be a resolution if it's going to be an opinion of the members. And the letter submitted by the president of the Philippine College of Physicians, according to Dr. Dairit, was only the opinion of its president because there was no resolution attached to it. No, and that's to give perspective to members of the IATF on how to weigh the conflicting expert opinion, no, being given by physicians. So it really has to
But
be emphasized. The recommendation of the
yeah,
IATF based on science was based also on doctors' advice, particularly although they had differing opinions. No,
yeah, but it still caused confusion, Secretary Roque, because even if that was approved Thursday of last week, the DOH, I remember, sir, was already saying, in spite of this, we still ask the public kung pwedeng doon pa rin kayo doon sa 1 meter distance at hindi doon sa 0.75. Again, the
no,
question
no,
is, why
no.
wasn't this?
The DOH statement never said that. They emphasized only the importance of observance of minimum health standards. I had to ensure that, of course, the DOH will not issue a conflicting press statement, and I have a copy of that statement issued by Secretary Berhere. There was no such thing. No, what she said was that the DOH was still insisting on minimum health standards. There was no mention of 1 meter in that statement.
DOH on this resolution. I did read this, sir, and I do remember that you are right. At some point, they said that the best, of course, is to practice safety protocols. But meron pong part doon, I remember, I'm gonna go back to it, sir, na sinabing kung kaya dun sa 1 meter distance, ay mas mabuti pa rin yun. So, be that as it may, Secretary, so how was that meeting like if it took 6 hours for the IATF to actually come up with a recommendation for the president? Ganun ho ba katindi yung naging arguments that it took that long?
Well, alam mo, I'm going to be candid. I started the line of questioning, no? And I addressed my concerns to Dr. Dance. Kasi Dr. Dance is also part of the same group that called for the timeout, no? So ang tanong ko na lang talaga, will the IATF's opinions really matter? Because it appears that Dr. Dan's group, whenever they speak to the public na, no? And they seem to be giving opinions na talagang government is making the wrong decision. So I wanted to be sure that we were not wasting time. Kasi if they were always going to insist on their position, regardless of other considerations, no, we might as well just accept the position of Dr. Dan's group as gospel truth, because I was not willing to waste time on it. No, but Dr. Dan, in fairness, said that of course they have recommendations, but they will bow to the policy of government. They know that it's going to be a difficult decision. They know that there's going to be other considerations that will have to be considered. No? And that's when I said, okay, fine, let's I will personally contribute to the discussion, given the assurance given by Dr. Dance. No, but you see, when we make decisions, government considers all aspects. Health is very important, but there's also the issue of livelihood. Marami nga nagsasabi, we could probably survive the coronavirus. Paano naman kung mamamatay dahil sa kagutuman? Transportation is very sensitive because although we want to open the economy, we cannot open the economy unless people can get to their work. Now, how are we going to expect workers to go to their place of employment if there's not enough public transportation? That's the essence of the debate. It's not as if one side wants to expose the population to the disease intentionally just for the sake of economy, because the reality is, even if you survive the disease, if you can't survive because you're in poverty, that would not really lead to any positive results. No? So it's a very difficult decision. It was a very difficult recommendation. I think the president knows it's not an easy decision, but I'd like to assure everyone over and over again that doctors were consulted, and not all doctors share the view that it is only 1 meter distancing that is the solution. There are very respected doctors, including 2 former secretaries of health, saying you could achieve containment of the disease by wearing masks, shields, disinfecting the public transportation, and more importantly, prohibiting talking, prohibiting the use of cell phones, because unless you open your mouth, there will be no
public transport
to speak of.
What, and listening to all sides, Secretary Roque, I know this is going to be the decision of the president. What was your stand? Saan ho kayo napunta in terms of evaluating the different opinions of the health experts? Kayo po personally?
Well, ako personally, si Dr. Manulet Dairit kasi cited an international journal study that it is actually the spread of the disease is if you actually don't wear masks, no? And what prevents the spread of the disease is the mask and the additional protection of the shield, which could further be reduced the probability of acquiring the disease if you don't speak, because there will be no opportunity for droplets to come out of your body, no? So to me, that sounds acceptable given the fact that we need to provide public transportation so that people can get to their work. But that is my personal opinion. I repeat, that was my personal opinion.
Yes, sir.
IATF came up with a recommendation, and that will be submitted to the president. It is the president who will decide. I think yun nga po, the other side naman, everyone knows the other side. I only had to explain my personal opinion because the physicians have already ventilated their view that we cannot compromise on the 1 meter social distancing as part of the minimum health standards, which is also the position of the Department of Health. So I've presented both sides, I think, fairly.
All right. So there's still a lot to talk about. Secretary, I'm just going to bring this in, the statement of the Department of Health. Further, we ask all Filipinos to continue to practice all elements of wearing masks, etc. Let me just get back to you. Let's get back to this. Let's take a very quick break. Secretary Roque, we'll be right back. Welcome back to The Source. I'm Pinky Webb. Our guest today, Presidential Spokesperson Harry Roque. Sec, I'll just bring this in. Ano po yung statement ng Department of Health, and let me read this. This is what I was referring to. Given the recent decision of the DOTR to optimize physical distancing in transportation and in the interest of public health, we enjoin all Filipinos to be extra vigilant in situations where distancing cannot be practiced. And this is what I was saying, sir. And if possible, choose to participate in activities or use transport options that can afford at least 1 meter distancing.
Yes. There's nothing there that says that
I wanted to make sure
you should not consider less than 1 meter. The wording was very, very particular. If possible, which is the same language of the WHO.
Enjoin the public, if possible.
WHO did not explicitly say you must never reduce 1 meter. If possible, reduce by 1 meter, or at least provide for distancing.
Right, that's why it said that can afford at least a 1 meter distancing. Yes. All right, COVID-19. Secretary Roque, there was a press conference yesterday, and basically you graded the country's response at 85%. Obviously 85% would mean the country is doing a good job on this. And in many instances, Secretary Roque, we always talk about testing. We have tested, I believe yesterday you said, over 3 million tests
Over 3
conducted.
million already, the highest in Southeast Asia, better than Korea, better than Japan.
Yeah. So I guess this begs the next question, Secretary. But we have a total of 270,000 cases. We have the highest number in Southeast Asia. So how can we have a grade, or how can you grade as 85% given this number, sir?
Well, of course, it's a pandemic. The disease will continue to spread until we find a vaccine or antidote. But what's important is you look at the deaths. Why are we scared of pandemics? Because we could die of it. But how many are dying? It's 1.7%. So what this is showing is that we know how to take care of those who get sick. We're also avoiding, to a large extent, the further spread of the disease. I keep on emphasizing that the fact that the UP group has been very accurate in predicting the numbers. And in the beginning, they predicted 3 million by June, and which did not happen. And the fact that we have incredibly increased our testing capacity from one, we now have in excess of, I don't know what it is now, no? In excess of 100, definitely testing capacity, no? And we have now exceeded our target of 3 million tests, no? And it's early in the game still, no? Because we're building even more labs, no? So I think in relation to the whole world, we're number 21, number 22, considering that we're not as wealthy as the United States and the rest of Europe, we have far less cases and far less deaths. I emphasize, kaya tayo natatakot sa pandemya, baka ikamatay. Pero mga namamatay po sa atin, 1.7%. Well, nalulungkot po ako na may namamatay pa rin. One death is more than enough. But compare this with the wealthier, more advanced nations which have higher mortality rates than the Philippines. So given the limitations of our health
There's a lot of
system,
factors.
I think we've done very good. We used the opportunity when we declared ECQ to improve our health capacity. And of course, now we realize that we need to build 50,000 more bed capacity to achieve the minimum standards imposed by the WHO. But we have rushed things. We have built further isolation units. We have inaugurated new COVID beds in East Avenue Medical Center and opening new ones all over the place. I think we've done a very good job given the limited resources that we have and given the fact that no one really in the whole world expected this kind of a pandemic.
But at 85%, there are problems, sir. Number one, this fact remains we have the longest lockdown. And number two, we have a problem on contact tracing. Very recently, the president signed the Bayanihan to where a portion of that will actually go to the hiring of contact tracers because we are definitely below par doon po sa contact tracing. So, saan ho napunta yung the 15%, that 85% we're doing a good job, 15% we're not. Ano ho yung 15% para po sa inyo?
Precisely, tracing. It's only now that we're actually going to use safety.ph as a tool, as an automated tool to help us in tracing. It's only now that we're implementing the General Magalong formula that tracing should go beyond the immediate members of the family and should include 37 close contacts, which we are now implementing, albeit it's not an absolute rule, no? Because depending really on where you are and the circumstance of the person, maybe it cannot be achieved, no? The 37 tracing. And it's only now that we have utilized even public schools as isolation units, knowing that we really need to resort to facility quarantine because even the asymptomatics who do not have their own bedrooms and bathrooms may still spread the disease even if they stay home, no? Particularly amongst their family members. So I can't give 100% because we're not perfect. We need to tremendously improve our tracing capacity, and thanks to General Magalong, I think we're headed towards the right direction. And of course, we need to build more isolation facilities to ensure that everyone who is asymptomatic can be accommodated in the isolation facilities.
But to some, Secretary Roque, 85% might be a bit too high because when you look at even, let's compare ourselves to the countries in Southeast Asia, we are the number one, the highest COVID-19 cases in Southeast Asia. And number two, when you look at all the articles online, it never says you will never find the Philippines being set as a role model in addressing COVID-19, whereas you have Korea, well, hindi iba po yun, but you have Thailand, and possibly even Malaysia. When I looked at the numbers of Thailand and Malaysia recently, sir, they were averaging about 0 to 5, 0 to 10 cases per day. And then we are still averaging about 3 to 4,000 this past week, Secretary Roque.
Well, let me correct you. Now, the New York Times cited the Philippines as having succeeded in lowering the numbers and keeping the numbers low. That's the New York Times. And we were, in fact, clustered together with countries like Korea already, in that classification. So the problem with Philippine media, of course, is they always echo the voice of the opposition, which is fine because this is a democracy. But that's why it's very important when you have a publication like the New York Times grouping us together with countries like Korea and Vietnam. It's important that we appreciate the efforts of this government. Isipin na lang po natin, marami nang namatay, pero mas marami pa pong dapat namatay. Yung kinatatakot natin na sangkatutak ang mamamatay dahil sa pandemya, hindi po nangyari dahil tayo po yung kauna-unahang nag-lockdown at dahil nga po dyan, nagkaroon tayo ng pagkakataon na improvein o pagbutihin yung ating kakayahan na magbigay ng medical na atensyon sa mga magkakasakit na nangyayari po ngayon. And the further good news is, as I speak, we're no longer at high risk as far as critical care capacity is concerned. We are at 50 to 60%
I heard that yesterday.
capacity because we have built more ICU beds, we have built more ICU wards, and more bed allocations have been given to COVID patients.
Secretary Roque, we need to take a very short break. We'll be right back. Secretary Roque, I need a quick reaction from you regarding this. The Vice President was interviewed by GMA yesterday, I believe, and when asked about why she wasn't calling for the resignation, I believe, of Secretary Duque, she answered this, and I quote, "Our problem is much bigger than Secretary Duque. For me, the problem really is with the national government appearing to have no system in place. Sabi pa po niya, for me, the system is what fails, not only Secretary Duque." Your quick reaction, please, sir.
She's entitled to her opinion. Of course, as the leader of the opposition, we don't expect anything positive about this administration from her. We've accepted that. I think people have accepted that. She can say all the negative things about the administration, but people still support the president.
Okay, I need to move on to the ombudsman. There was a revised guideline on the release of SALN. I know, Secretary, this has been asked from you yesterday and even during your last press conference. Ang sabi po is that there are now reasons or justifications before one can secure a SALN of the president. But the ombudsman has revised this and said kailangan authorized representative of the individual upon order of the court. The ombudsman field investigation looking for this for fact-finding and an authorization from the person. My question, Secretary, is does this not contradict with the president's stand on transparency and even his executive order on the freedom of information?
No. Anyone can request a copy of the SALN complying with the requirements of Executive Order Number 1.
The Philippine Center of Investigative Journalism, sir, has been requesting for the SALN, apparently, of the president, his 2018 SALN since 2019, and the repeated requests before the Office of the Executive Secretary and the Ombudsman, they have not been given a copy of this, sir. So there's a request, pero hindi po nabibigay.
I can't comment on that because I don't know what procedure they followed, because there is also a procedure provided in EO number 1, and you need to comply with it regardless of who you are as a requesting party. So just ensure that you comply with the requirements.
But why does this, what kind of siguro signal does this send, Secretary Roque, knowing that, the president is supposed to be calling for transparency, signing executive order on the freedom of information, and yet you have people asking for his SALN and this is not being released?
Well, Pinky, I can't answer a question with the wrong premise. The premise there is that he is concealing his SALN. He's not. There's a mechanism to be followed, follow the mechanism. If that doesn't fail, then pursue further avenues under existing laws. Chavez versus the case of Chavez says that the remedy is file a writ of mandamus if you must. But you need to exercise your rights. If you think your rights are being violated, and if that right is freedom of information, then do as you must. But I can't actually concede that the president is concealing anything because, as far as I know, he's filed his SALN and it's been reported upon.
Okay, we've run out of time. Thank you to you, Presidential Spokesperson Harry Roque.
Thank you very much, Pinky. Good morning to everyone.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.